Hi, everybody. My name is Heidi Gabr. I'm a current PM&R PGY3 here at Case Western Reserve University at the Metro Health System in Cleveland, Ohio. Today we have here one of our interviewees for the annual assembly. I'll have him introduce ourselves. If you could go ahead.
Sure. My name is Matt McLaughlin. I'm a pediatric rehab medicine physician at Children's Mercy in Kansas City. I did my residency at University of Missouri in PM&R, and then I did a fellowship in pediatric rehab medicine at Children's Mercy, and secondly, a clinical pharmacology fellowship sponsored by the NIH at Children's Mercy as well. And then since that time, I have gone from assistant professor to associate professor and professor of pediatrics at Children's Mercy, where I continue to do a fair amount of NIH-funded research. I've gotten my MBA and Master's in Healthcare Leadership and Management from University of Texas at Dallas, and now I serve as the Division Director for Rehabilitation Medicine and Interim Division Director for Clinical Pharmacology, Toxicology, and Therapeutic Innovation.
Awesome. Thank you so much for joining us today. So we'll just go ahead and go into our questions. The first one that we wanted to ask is, why did you choose PM&R?
I think to me, PM&R was the quintessential field for me because it's the one that actually made the most sense. Heidi, for me, I saw so many patients in the hospital that when it came time for us to actually discharge somebody, nobody knew what to do if they couldn't just immediately return to home. And for me, PM&R filled that void and trying to work on a patient's function to get them back to a home setting. And for me, as a pediatric rehabilitation medicine physician, it is obviously all about improving quality of life for kids with any kind of childhood onset disability. And that a lot of times for me is focused through all my efforts with adaptive sports and with treating kids with limb differences.
Amazing. I'm a little bit biased, but I have the same feelings about PM&R.
Wonderful. Thanks, Heidi.
We wanted to know a little bit about your session for the Advanced Clinical Focus Day.
Yeah, so the Peds Rehab Medicine group has a full day for the Advanced Clinical Focus Day. And one of the topic areas that we're really excited about is pediatric rehabilitation medicine physicians and their pathway towards leadership. And so there will be an entire session that's focused on people who have been historical leaders in the field who will be able to kind of present their dyad, for lack of a better word, of mentor-mentee relationships to try to talk about how they've been able to sponsor people in their institutions to kind of go forth in leadership, which is a big thing that I think many pediatric rehabilitation medicine physicians are natural born leaders, but it's always one of those things that when we're cohesive in our thought processes and think about the way that we're working towards and bettering lives of children, we can do it a much better way than if we're individually trying to do it ourselves.
Definitely, I know a lot of us are really looking forward to it. So, moving on to our next question is, what is your favorite part about working in PEDS PM&R?
My favorite part about working in Peds Funar, at least for me, is obviously the kids. When you get to be around the kids and you get to have FaceTime with the kids, you get to watch them grow and improve and mess with them as I too often do by telling terrible dad jokes. I feel like that's literally why you go into the field itself. But for me, at least at Children's Mercy, I also have to say I gain a lot of strength from the people that I get to work with. The physicians that we have in our group are just unbelievable in the way that they sacrifice of themselves for the betterment of the kids that we get to see. And I think I never have to think about or question the motive of anybody that I work with because of the fact that they just literally always come from the best possible space whenever they're coming into a room to treat a patient or whether they're coming to a meeting to meet with me about something that we want to grow or change or expand. I always have a feeling that they have the best interests of the kids that we see at heart.
That's amazing. It's important to be around people like that in your
Yeah.
workspace.
Yeah, very much so.
And it's hard to come across sometimes. Sometimes you just really luck out.
Yes, very, yeah. And that since I have, yeah, very much have, Heidi.
Um, what is one area of research in PEDS PM&R or a change in the practice that you find exciting?
Well, of course, nobody finds your research as exciting as you do. So I will say initially my own type of research, right, Heidi? So talking about why certain medications work in some kids and why they don't work in other kids. And that's not just in kids, but the adults patients that we see in PM&R as well. So for me, just looking at the differences in drug exposures and drug concentrations and how much that impacts different levels of clinical response that we see in some of the patients we see. To me, if we could find a way to standardize some of those aspects of drug exposures instead of just thinking only about the dose, we may do a lot better with trying to develop what actual clinical responses we want to see in people.
Awesome. And then on to our last question, which is our fun question.
Okay, fair
Now,
enough.
now I want to hear a dad joke. What is something that you enjoy doing for fun?
Um, I've been really involved in long distance bike riding and long distance triathlon. So I'm training right now for an Ironman distance triathlon, which is a little bit scary for me to do again, as I haven't done one over until maybe 10 years ago was the last one I had done. And so it's been a bit of time since that was something I did. But in addition to kind of doing that kind of work, one of the things I really enjoy doing is I work for the Union Cycliste Internationale, which is the national organization that governs Paralympic cycling and all the other cycling races around the world. And so I am a classifier for paracycling and essentially have been all over God's green earth doing paracycling competitions, Toronto and Quebec and Rio de Janeiro and Venice and Belgium, where I just came back from last month because I got to ride some of the famous cobbled classic climbs that are in that area of the country, which was just a dream come true. It's like a baseball player getting to play at Wrigley, or a football player getting to play as on such hallowed grounds of Arrowhead Stadium in Kansas City.
Oh my God, it sounds like those would be beautiful.
It was an awesome place, Heidi. It's a kind of green grass that you're not used to seeing here sometimes in the United States.
Yeah, definitely. Where would you want to go back?
I loved Belgium an awful lot, but I would always say that for the culture and for the uniqueness of the place, Venice was a wonderful place to get to go to. But at the same time, being at a place like Rio de Janeiro, where they had the 2016 Olympic Games, and getting to kind of go see all the sites, see the pool, that there were so many gold medals won by U.S. swimmers in. That was a very awesome thing. Seeing the velodrome and getting to walk on the velodrome. That was a very cool experience because it's essentially where all these high level athletes have been and something that you may not think you ever get a chance to see, but when I get to see those things in my life, I'm always very thankful and appreciative.
Well, thank you so much for sharing. It was nice to talk with you.
Yeah, thanks, Heidi.